Ash, the Chief Health Officer says that Wednesdays are usually spike days, so he's pleased to see only 216 new infections recorded today. The number of active cases has also dropped by more than 100, but the number of mystery cases has still grown by another 82, taking the total number of mystery cases in Victoria to more than 3,700. Now, sadly, 12 more Victorians have died from COVID-19 in the last 24 hours, all connected to aged care homes. Now, today was supposed to be the last day of Stage 3 restrictions. As we know, that is certainly not the case, and Melbourne isn't even halfway through Stage 4 yet, but the Chief Health Officer has disputed any suggestion that Stage 3 restrictions didn't work.
I wouldn't say that Stage 3 restrictions didn't work. There's been analysis of the Stage 3 restrictions that it did bring the effective reproduction number down below 1 or very close to 1, and it was up above 1.6. So Stage 3 restrictions absolutely made a difference, and really the effects that we've seen over the last week are Stage 3 effects, as well as the effects of universal mask wearing.
Ash, we've just received an update from Victoria Police on the number of Victorians fined for not self-isolating. As we know, every Victorian who tests positive for coronavirus can expect a knock on the door from the Army or a police officer. Now, just before Stage 4 restrictions was announced, Premier Daniel Andrews declared that his data showed that 1 in 4 Victorians were not isolating when they should. Well, Victoria Police has just put out that number of the number of people who have been fined for not isolating, and that is 42. So certainly a lot lower number, considering there has been thousands of door knocks, and it's certainly nowhere near close to 1 in 4 Victorians doing the wrong thing for not self-isolating.
Patrick Murrell is also with us. Pat, interesting today to see the Prime Minister Scott Morrison clarify some of the comments he made on Breakfast TV, in which he appeared to deflect responsibility for the aged care situation to the Victorian government.
Yeah, that's right, Ash. And the Premier here, Daniel Andrews, as always, has been very careful not to openly criticise Prime Minister Scott Morrison or give any indication there's a rift between the two. Now, these comments were originally made on Breakfast TV this morning. Prime Minister Scott Morrison apparently deflecting responsibility from the coronavirus situation in aged care homes from the Commonwealth to the Victorian government, saying that while ultimately Commonwealth was in charge of regulation of these homes, it was the Victorian government who had charge of the public health, so that pandemic response. Now, those comments have since been dialed back. In his media conference, he said that it is ultimately a shared responsibility, the pandemic response between the Commonwealth and the Victorian government. Take a look.
When you have a community pandemic, then the virus will find its way into many places. It can find its way into shopping centres, it can find its way into workplaces, it can find its way potentially into schools. And so it's the overlapping of public health responsibilities, which would sit with states, and federal aged care regulation responsibilities, which sit with the federal government. So yes, it is a complex set of responsibilities, and they are shared, and that's why we're working together.
I'm not interested in getting into a process where I try and interpret for you comments that the Prime Minister's made. It may surprise you, but I've not seen the comments he's made. I've been briefed in general terms, but I did not.
You don't see that as an attack on your government?
Well, the only attack that matters is our collective attack against this virus. That's what I'm focused on.
Now, while the Premier didn't openly criticise Prime Minister Scott Morrison, he did send a barb in a way today, pointing out that while there were 2,050 active infections of coronavirus within the aged care system in Victoria, only 5 of those were in state-run homes as opposed to the Commonwealth-regulated, privately run facilities. Now, when asked why he would point this out and whether this was perhaps a jibe at the federal government, he simply said that these were just the facts.
I'm not seeking to make any other point than the facts, and they are the facts, and I've consistently presented them that way. And if it's okay by you, I'll continue to do that. That is the appropriate thing to do.
Now, Ash, while the aged care situation here in Victoria is stabilising at the very least, there are some still very worrying numbers. 2,050 active infections. That is still going up slightly, although not surging as we saw in recent weeks as well. Sadly, as you heard from Gabriella before, all 12 of the deaths recorded in Victoria from coronavirus today can be traced back to those aged care facilities, and sadly that is a number that will only grow over the coming weeks.